for life, I suppose.
Something else now, and still on the subject of kids' safety, and there's a worrying increase in the number of young people being prescribed antidepressants.
Every year there are over 12 million scripts for antidepressants written in Australia. As alarming as that stat may be, figures reported today show the number of children under the age of 6 taking these drugs has soared by almost 50%. Equally scary is data suggesting that since 2009 there have been 89 adverse reactions linked to antidepressants in children under the age of 9. And antidepressants may have contributed to 5 deaths in kids aged between 10 and 19. Psychiatric medicines are used to treat a wide-ranging variety of conditions in young people, from mental conditions such as depression and anxiety to neurological conditions such as chronic bedwetting. With such a reliance on medication in today's society, are kids being too readily prescribed heavy medication, and what could the long-term side effects be?
Professor of Psychiatry John Giardini is the leading expert, or a leading expert, on childhood depression. Now, John, is there any good reason for a 6-year-old or someone even younger to be given antidepressants?
For anxiety or depression, no, not at all. And in fact, there's very little reason for children of any age to be given those drugs.
Why are you so against them, John?
Well, simply because they've not been demonstrated to work, and in fact they've been fairly clearly demonstrated not to work. And in that setting, it's not worth taking the risks that are associated with using drugs that affect the growing brain.
So what you're saying, that it's not really about depression at all. It's not really about mental illness.
Well, I think the use of the drugs is it's not to treat mental illnesses in children of this age. I think the use of drugs like this reflects the fact that the doctor hasn't really understood what's going on for that child.
So are you saying that perhaps doctors are just too quick to prescribe them and using that as a quick fix solution?
I think if you are prescribing to small children, you're by definition too quick to prescribe, because there isn't a role for using these kinds of psychiatric drugs in small children.
Can you think of any reason why there is such an increase in the number of kids being put on antidepressants?
Well, again, you have to be really cautious about these figures, because overall the numbers are low and the apparent increase might not be a sustained phenomenon. But I think if there is an increase, it's a reflection of our kind of a pill for every ill attitude to well-being.
Mate, I've got a 2-year-old who has many tantrums. Thankfully, at the moment, the duration is very brief on them. But, if someone had a kid who was really seriously struggling, what do you advise they do?
Well, they need to find somebody who will take a very careful history of the circumstances, and good psychological health isn't about medical diagnoses and medical treatment. It's about taking feelings seriously, listening to people's stories, helping them to make sense of it.
And thankfully kids are very resilient too, John. Thank you so much for your time tonight.
Thank you.
It's such a hard one, because I think no parent wants to see their kids struggling. You do whatever you can to stop your kid, when they're not feeling themselves.
Must be at their wits' end if they...
Well, that's it. You'd hope it was very much a last resort, and that counselling and specialists could be used before that point.
Yeah, a bit of basic parenting first. Well, give that a try.
Hope, yes.
But of course there are a lot of kids that need some medication. There are kids with special problems.
It's a tough one. Well, moving on now, and some might say he's everywhere, but does God belong in our schools?
We're unashamed